Hi everyone, welcome back in today's video. So in this tutorial I am going to talk about which reading is more important when measuring blood pressure. So blood pressure is the force of the blood pushing against the artery walls during the contraction and relaxation of the heart. Each time the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure as the heart contracts. When the heart relaxes, the blood pressure falls down. So generally, two numbers are recorded when measuring blood pressure. The highest number, which is known as systolic pressure, so it refers to the pressure inside the artery when the heart contracts. It pumps blood throughout the body. The lower number, which is also known as diastolic blood pressure, it refers to the pressure inside the arteries when the heart is at rest and is filling with blood. So both the systolic blood pressure and the diastolic blood pressure are recorded by the sign mmHg, which means millimeters mercury above the surrounding. So in this video I am going to explain which reading is more important when measuring blood pressure. So before we dive into our tutorial, I would like to give you some tips before measuring blood pressure. For example, always it's good for you to instruct the patient to relax 5 minutes before you start measuring the blood pressure. Secondly, so you instruct the patient to avoid having caffeine or drinking a tea containing a coffee. Third, the patient should be not in a state of having an urgency of urination. Number 4, instruct the patient to sit upright normally in a normal posture, so by avoiding having his legs crossed, so that will disrupt the normal reading of blood pressure, which will give you invalid result. Then for example, so when you look at the blood pressure, we have two numbers. We have the systolic and we have the diastolic. So generally the systolic pressure is considered the most important one. This is because when the blood pressure is high, there will be an increased resistance, especially the arteries. So the arteries may have an increased resistance against the pushing of blood in the artery walls. So therefore, it is important to consider the systolic pressure because it is the most important one. Secondly, it indicates if there is increased risk factors like cardiovascular disease, heart attack, heart failure, or stroke. So the systolic pressure is considered to be the most important one whenever you are measuring blood pressure. So, and it's always important for you to measure the blood pressure once, twice, or third to confirm if the patient has a blood pressure. And how do you know if the blood pressure is high or normal? So generally, a blood pressure can be categorized as normal, elevated, stage 1, stage 2, or hypertension crisis. So the normal blood pressure for an adult person is a systolic pressure that is less than 120 mmHg, and the diastolic pressure less than 80 mmHg. Okay, that is when the blood pressure is normal. What about if the blood pressure is elevated? So elevated blood pressure can be expressed as a diastolic pressure starting from 120 to 129, and diastolic pressure is 8. Okay, third, and stage 1 hypertension starts from 100, a systolic pressure that is starting from 130 to 139, and diastolic blood pressure from 80 to 89, that is stage 1 hypertension. What about stage 2 hypertension? So in stage 2 hypertension, the systolic blood pressure will be greater than or equal 140 mmHg or higher, and the diastolic pressure will be greater than or equal 90 or higher. What about hypertension crisis? So hypertension crisis is when the blood pressure reading is greater than systolic pressure greater than 108 or above. Let me repeat. You can know if the blood pressure is hypertension emergency or hypertension crisis if the systolic blood pressure is greater than 180 mmHg or above, and the diastolic blood pressure is greater than 90 or higher. That is what we call hypertension crisis. So it's important for you to consult your doctor or physician if you think that your high blood pressure is high. So thanks for watching. Have a nice